Everyone, I'm Pharmacist Michael, and today I want to talk about my favorite antidepressant, which is Zoloft. So stay tuned. You're not going to want to miss this one.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
The first thing that I want to tell everyone here is you should never start with an antidepressant if you can get by without one. So I recommend you try coping mechanisms, psychotherapy, and other things before going to the doctor to get put on an antidepressant. But if you are going to be started on an antidepressant, for most patients we would start with an SSRI. Zoloft was the second SSRI that was released in the USA right after Prozac. It was approved by the FDA in 1991. In the year 2020, Zoloft was the most prescribed antidepressant in America and was the 12th most prescribed drug overall. Again, Zoloft or sertraline is an SSRI, which stands for selective serotonin reuptake inhibitor, and we believe it works by allowing more serotonin to be available for neurons. I want to stress, and this is important, that all antidepressants increase the risk of suicidality in pediatric patients and young adults. So always keep that in mind. What do we use sertraline for? Well, major depressive disorder is one of the things for sure. Obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, premenstrual dysphoric disorder, and social anxiety disorder. And these are the FDA approved indications. We also use sertraline off-label for binge eating disorder, body dysmorphic disorder, bulimia nervosa, generalized anxiety disorder, and premature ejaculation. How do you take Zoloft? Well, you start at a low dose, normally 25 to 50 milligrams once a day. Zoloft is almost always taken once a day. Most people take it in the morning, but if it makes you sleepy, you can take it at night. It doesn't matter either way. And then slowly we titrate the dosage upward to 100 to 200 milligrams per day. If you miss a dose, take the next dose as soon as you remember. But if it's close to the next dose, just skip it. You don't want to take 2 doses at the same time. And be sure when stopping Zoloft that you don't stop it abruptly, as this can cause discontinuation syndrome. It's always best, especially after taking this drug for a long period of time, that you slowly titrate off of it. So after you've been taking it and you go to the follow-up appointment with your doctor, I'm going to tell you what should happen. If you have no response to sertraline at all, they should change you to a different medication, either a different SSRI or SNRI. Now, it depends on your other types of problems that you're having. If you're having problems eating and sleeping, they may start you on Remeron, but for the most part, for most of us, if it doesn't work at all, they're going to switch you to another drug in the same class or an SNRI. If it works, but it's not a full response, we'll increase your dose. And if you feel great, we'll keep the dose the same. The reason I'm telling you this is if you go to the doctor and it's not working at all, they should not increase your dose. They should change it to something else. They also shouldn't add anything to it. If it doesn't work, it doesn't work. Another advantage of Zoloft is it's one of the drugs that is preferred if you need an antidepressant started during the first trimester of pregnancy. It's one of the drugs that we actually would like you to use in that case. But if you're pregnant or breastfeeding, always check with your gynecologist before taking any medications. I always recommend that just to be safe. Who shouldn't take Zoloft? People with liver disease, people with active bleeding, people who have low sodium. Bipolar patients should never take an SSRI or an SNRI because it can predispose them to a manic episode. If you need an antidepressant and you're bipolar, Wellbutrin is always the best choice unless you have a seizure disorder or you're allergic to it. It's important to always let your pharmacist and doctor know what other drugs you're taking before you start drugs like Zoloft, because there are drug interactions. What are the side effects of Zoloft? Well, there's a lot of them, just like there are with every antidepressant, but I'm gonna just hit the high points and the ones that you need to be cautious of. It can increase the risk of fractures. It can increase your risk of bleeding, especially if it's taken with a non-steroidal anti-inflammatory drug such as ibuprofen. It increases your risk of hyponatremia. It can also cause serotonin syndrome. This is very rare and usually only occurs when other serotonergic drugs are taken with Zoloft. And this is why it's important that you let your pharmacist and doctor know other medications you're taking, because there are drugs with serotonergic properties that you may not realize. Ondansetron or Zofran is one. Imitrex for migraine headaches is another. So these are things that you may not know, but the pharmacist and doctor should know. Signs of serotonin syndrome are hallucinations, confusion, a fever, a fast beating heart, flushing, muscle twitching, stiffness, seizures, shaking, diarrhea, upset stomach, and a very bad headache. So if you experience any of these symptoms after starting Zoloft, be sure to contact your physician because they really do need to know about this. Sertraline is a great drug to start with. It's not for everybody. It doesn't work for everybody, but it's a good drug because it has fewer side effects than some other antidepressants. It's well tolerated and it's been around for a long time, so we have a lot of data on it. If you know somebody who would enjoy this video, please send it to them. If you've enjoyed it, give it a thumbs up. Please subscribe to my channel for more happy, healthy living information. And be sure to check out the description section of this video for other products that can help you live a happy, healthy life. My name is Pharmacist Michael. Be happy and be healthy.